I've worked in the medical field, well, now for about 20 years. So it was great. I've been a patient advocate for that long and actually never thought I would have a dog. And when I got here, I was told, you will never have animals at Boston Medical Center. After the Boston Marathon, NEADS came into Boston Medical Center to meet with patients who might be interested in adopting a service dog. And that was also the opportunity I had to meet with them directly, to talk to them about possibly having a NEADS dog as a hospital-based dog. Boston Medical Center is the busiest trauma center in New England, so it is not always the easiest place to work. It's often fraught with high emotion, and the dogs really help people feel better at times where we might not be feeling that great. Just having the dogs walk through the hall makes people feel better. The impact on staff has been probably the biggest surprise for me. And the dogs have become such a part of the fabric of BMC that I can't imagine this hospital without them now. I've noticed that, and as I mentioned, I've been in healthcare for 20 years and have seen a lot, but there's a difference when the dog walks into the room. They make a connection that is very different than the caregivers and the care team and everybody else who comes into the room. We have patients who are here very frequently who, every time they come in, ask for Riley by name or ask for certain dogs by name. We've also been asked to be present at end of life. We just had, last Friday actually, a request. A young man was dying and his 14-year-old son was coming in to say goodbye. And the social worker asked if Healing Paws dog could be there for the son, to help support the son as he said goodbye to his father.
It is an enormous privilege to see how NEADS dogs can impact not just people with physical challenges, but the invisible challenges that often come, spiritually or emotionally. To be able to address those is the highest privilege.
These dogs do heal patients on a level that is so unique, and patients have actually said it. Riley will be in bed and the patient will be petting Riley and the patient will say, this dog is healing me. And the feedback I've gotten has just been amazing. In fact, our chief medical officer went to a meeting with the emergency department attending physicians not too long ago, and the message that the chief medical officer had for me was, more dogs. Okay, we're trying.